Hi everyone, Dr. Jamie here. I think I mentioned in a previous video that I like to talk about principles of health and wellness just as much as I like to talk about the scientific details. So one concept I want to drive home for you all is the concept of thinking about what you want, not what you don't want. This is probably not news to anybody. I think we've all heard it before, but in reality, most people don't practice this, especially when it comes to health and wellness. We're very keen on what we don't want, all the bad things, all the issues and conditions that we're just so done with, like we don't want another sleepless night, and we don't want to experience another migraine. We don't want to have cramps or hot flashes. We don't want to feel bloated or constipated. We don't want to feel tired and irritable, and we certainly don't want to have pain anymore. And when my patients come to see me, they'll easily tell me all of their problems and all of the things that they don't want and don't like about their health in great detail. And of course, I want to know and I need to know what's wrong so I know what we're dealing with and what we're trying to change. But when I pose the question, what is it that you do want? It's incredible how my patients will pause and then light up and begin to show instant vitality just thinking about their hoped for new state of being, just entertaining the idea, the vision of themselves better. It's very powerful, and I think it's a critical step in healing to have clarity about what you want and the direction in which you want to go. So start thinking about what you want to experience, not just what you want to get rid of or what you want to depart from. If you do that, you're stuck in the past, but we're trying to create a new future. So instead of thinking, I'm tired of my low back pain, think, yeah, I'm looking forward to playing with my kids at the park or exercising again or going hiking in the mountains, or I'm working on waking up super refreshed after a solid 8 hours of sleep. Or I want to enjoy a delicious meal and I'm going to feel energized and light and clear headed after. It's two sides of the negative positive coin. So it's acknowledging the negative, what's wrong in the circumstance. Then the opposite side is affirming the positive. What good can we move towards? We should do both. Acknowledge the negative, then affirm the positive. An example would be, I have serious issues with my gut because I'm bloated and constipated all the time. But on the flip side, and the side that I'm going to focus on is I'm going to make great food choices and I have healthy digestion and regular bowel movements. So every thought we have elicits an emotion, and every emotion elicits a chemical change in our body. These biochemical changes occur as neuroplasticity in our brain, action potentials across our nervous system, hormonal changes, and certainly inflammatory changes and cardiovascular changes like heart rate and blood pressure. So how we're thinking about our health problems alone can be a spark for healing or an obstacle for healing. But at the very least, on a practical level, you need to have a clear vision of what you want to experience in your health. Without that vision, it's going to be very difficult to commit to the work and the behavioral changes necessary to achieve your goals. So you need a clear vision, you need a strong why, and you need to think about what you want and why you want it, and not get stuck on what you don't want, because positive changes will not happen without consistent thought about that desired goal. All of your emotions and behaviors and habits will follow your thinking. So think of what you want, not what you don't want.